Hi everyone, my name is Julia. I'm a birth doula, and today I'm going to be talking about a big concern that a lot of women have in childbirth: tearing. Now, if you have this fear, know that you are not alone. It is a part of the process, especially if you have an epidural, but there are things that we can do in pregnancy and in your labor that can reduce the risk of tearing. The preparation that you do in pregnancy is key. One of the best ways that we can reduce the likelihood of tearing is making sure that you are in alignment and that your baby is in an optimal fetal positioning for birth. So, how do you get that alignment in your body and ensure that your baby is in an optimal fetal position? The Body Ready method has some fantastic techniques to help align your pelvis and to ensure that baby can nestle into a really good position. Keep in mind that alignment isn't just about your baby getting aligned, it's also you. So, thinking about your posture, when you're watching TV, are you just slumped with your pelvis tilted and tucked? Thinking about maybe doing a pelvic tilt forward or doing deep squats or maybe some hip circles on a birth ball. Just incorporating that movement and really thinking about your posture can help get baby into an optimal position. Walking is a really great tool to help start this process. Once you're actually in labor, what can you do to reduce the risk of tearing? Movement. Movement, move as much and as frequently as you can. Whether you're planning an unmedicated birth or a medicated birth, moving is your best friend. In active labor, think about changing positions every 30 minutes or every 5 contractions. Even if you've opted for an epidural, movement is usually still possible. I always recommend getting on your side with a peanut ball between your knees or your ankles, depending on where you're at in your labor. I've even had women get on all fours if they have a lot of movement in their legs. You just need, people on either side of you to just steady yourself. But being on all fours just releases some of that or relieves some of that pressure on your perineum. When it comes down to it, we really have to talk about pushing, and it's pushing with a purpose. We want to work with your body, not against it. So for a medicated or unmedicated birth, you want to push when you feel the urge to push. With unmedicated, you usually can't help it. You have that natural expulsive reflex, and it usually feels good to push. If you have an epidural, it's important to wait for the right moment. While you might not have every single sensation as with an unmedicated birth, you'll still feel some pressure down there of your baby's head moving down. So you want to wait for the right moment until you feel that urge. A lot of women describe it as feeling the need to poop. And I know everyone is very scared about pooping in labor, but it's actually a good sign that your baby is in a position that you're kind of using the right muscles down there. The longer you push when your body is not ready, it increases swelling, which ultimately increases the risk of tearing. Waiting for that feeling of pressure allows your body to naturally open, decrease swelling, and decrease tearing. So, to recap, you want to think about alignment and optimal fetal positioning in pregnancy, movement, and when is the right time to push. If you can kind of nail down those three things, you'll reduce the likelihood of tearing. Now, every birth is unique, yours is no different. We're not going for perfection here. We're just going for an empowered, informed birth. Thanks for watching. Bye.